All right, and on to diseases and abnormal conditions. The urine abnormalities, really, it's helpful if you can remember your medical terminology. Poly means many. All these ureas is referring to urine, so excessive urination. Oligo means few, so this is small amounts, too few urination. An means without, anuria without urination. Noct means night. Nocturia, excessive urination at night. Hematuria, hema means blood, so blood in the urine. Pyuria, pyo is pus, so pus in the urine, which is a sign of infection. Proteinuria, if there's protein in the urine, which as we just talked about, that's an abnormal thing. Protein should not be being filtered out in urine. Dysuria is difficult or painful urination. Retention is when you retain urine in the bladder after you've tried to empty it, so you're not able to completely empty your bladder. And incontinence is kind of the opposite, where you can't control, like you lose control of the sphincter muscle and you're unable to control when you're voiding. A UTI is a urinary tract infection. In general, that means that there's a pathogen present somewhere in the system. So it might be the urethra, it might be the bladder, it might be the kidneys, and so on. In general, it's usually a bacterial infection. It can be a viral infection, but it can also be any of those 6 types of microorganisms that are pathogenic. Something you do want to consider as you're looking through this, all of the UTIs that we're going to talk about have some symptoms in common, so make sure you're focusing on those. Things like dysuria, difficult or painful urination. Urine tends to be malodorous. Mal means bad, bad odor, smelly. Pyuria, or it might be cloudy for other reasons. It might be cloudy from pus. It might be cloudy because there's white blood cells there to fight the infection. And then other signs of infection are your fever and chills, burning while urinating, and stuff like that. Urethritis is the first type of UTI we talked about, but this is the one that's not always a UTI because it's sometimes caused by chemicals getting inside the urethra, maybe bubble bath solution or some sort of chemical that just irritates it. That doesn't mean there's an infection there. So it can be a UTI, but it doesn't have to be. This one's the only one that's more common in males. Signs and symptoms, again, kind of the ones we talked about up here. Treatment would be antibiotics if it is a UTI. You can try to control pain with a moist warm compress. And then for all of our UTIs, we want to increase the fluid intake to try to get the kidneys to work harder and flush out the system. Cystitis is inflammation of the bladder. Remember, cyst is bladder, itis is inflammation, and this is most commonly a UTI, a bladder infection. Females are more prone to bladder infections in most types of UTIs because their urethra is shorter, so pathogens can more easily travel up through it. Signs and symptoms, again, focus on what kind of is for all of them. Blood in the urine, malodorous. Also, this can be painful. You might be peeing a lot because your kidneys might be trying to work hard to get things flushed out. Treatment is antibiotics and increased fluids. Pyelonephritis. This was the kidney tissue itself was inflamed, and also the renal pelvis, which is that first part of the ureter, can be inflamed, usually from a UTI, usually from an infection in this area. Similar to cystitis are your signs and symptoms, and the same as cystitis for the treatment. So don't think too hard about the UTIs because signs and symptoms and treatments are pretty much very similar for almost everything. But let's move on to nephritis or glomerulonephritis. It's the same thing no matter which term you want to use there. So this is specifically the glomerulus is having a problem. If you remember what the glomerulus is, that's the part of the nephron where blood enters and filtration occurs. So when you have a problem with your glomerulus, your kidneys are not going to be able to filter appropriately, and you're going to have a lot of problems from that. So acute glomerulonephritis is an infection of the glomerulus. It's a UTI. Chronic glomerulonephritis can happen if you get a lot of attacks or bouts of acute. Signs and symptoms, you're going to have your signs of a UTI, but also because the filtration's not happening correctly, you might actually instead have oliguria, so you're not producing much urine because your kidneys aren't filtering properly. You can have swelling because your filters aren't working and you're not peeing out the fluid that you should be, so you're like overhydrated almost, gets into your body tissues. You might have protein in the urine because your kidneys are allowing protein in when they shouldn't be. Uremia, which we'll cover later, but if you remember what that is, it's an accumulation of waste products in the blood. Again, your kidneys aren't filtering properly, so your mineral levels will be out of whack in your blood and things like that too. Chronic can eventually lead to chronic renal failure if you're having tons and tons of attacks of nephritis. It's going to damage the glomerulus. So treatment would be to kind of treat the UTI for acute. For chronic glomerulonephritis, you're going to have to be treating for chronic kidney failure, which we know is using dialysis and eventually possibly a kidney transplant. Renal calculi is the fancy way to say kidney stones that form from calcium or minerals getting into the urinary tract, sometimes in the nephron tubules or the renal pelvis. They can also be in the bladder, but this would technically not be renal calculi, it would be a bladder stone. Signs and symptoms, really the big thing people say are they're super painful. They might be peeing blood, hematuria, because when the calcium crystallizes, it is very sharp, and that's why the pain comes too. Sometimes people stop peeing or retain urine because if the stones are big enough, they can block the path of urine. Treatment, patients must have their urine strained to see if they're passing the stones. If they're not passing the stones, then they have different procedure options like a cystoscopy to view the bladder and remove the stone, lithotripsy to use shockwaves to crush the stones, or surgery to go in and physically remove the stones too. Uremia, we talked a little bit about just a minute ago, but that's when you have waste products in the blood that are normally excreted in the urine. So that's a problem with your nephrons not filtering properly, really, which is leading to problems in the blood that's going to cause problems all over the body. Most common causes are renal failure or glomerulonephritis, whether it be acute or chronic. Filtration is not occurring properly for either of those. Signs and symptoms. Read this. These occur because your filters aren't working. So if your filters aren't working, think about what's going to happen. Those toxins, you really have toxins in your blood traveling all over the body, and the brain takes a hit from that. So you can get headache, dizziness. The chemicals can make you nauseous and vomit. You can actually smell it in the breath. Small amounts of urine, because we're not producing urine as we should be and filtering properly, confusion, convulsions, coma, and death. So really end stage problems with kidneys can affect the brain because the toxins affect the brain. Other parts of the body will be affected too, but that's a major part affected. Treatment, we need to try to take it easy on our kidneys by modifying the diet, trying to control fluid balance, trying to control the amount of electrolytes and toxins in our food and things like that. Dialysis and kidney transplant we'll get to in just a minute. Acute versus chronic renal failure. Acute is when it's a sudden loss of proper function. Chronic renal failure is this long-term gradual thing. Acute doesn't necessarily mean it's not severe. It's actually very severe. As many as 50% of people with acute renal failure end up dying from it. So it can be caused by many things, not taking good care of your kidneys, hemorrhage, so blood's not getting to the kidneys appropriately and they get damaged from that, and then your UTI, acute nephritis, and so on. Signs and symptoms, filtering's not happening properly, so you'll see a lot of the same signs and symptoms as uremia. Treatment, we want to try to figure out what caused this renal failure and fix that. In the meantime, we need to take care of our kidneys by modifying the diet and possibly going on dialysis. Chronic renal failure, again, was that long-term, caused by maybe chronic glomerulonephritis, people with uncontrolled hypertension, blood's not getting to the kidneys and the kidneys lose the ability to function correctly. Diabetes, same thing, damage to the blood vessels that travel to the kidneys, and then chronic alcoholism and substance abuse or use of toxins and things like that. Signs and symptoms, again, it's a filtration issue, so you're going to have waste buildup in the blood and see all the things that come from that. Treatment options, same thing, but if you have chronic renal failure, the end goal might be to have a kidney transplant. So let's move into that. Dialysis and kidney transplants. Dialysis is a treatment, not a cure. So it's the artificial filtration of the waste products out of the body or out of the blood. This is to help prolong the life of people with kidney failure, but it's, again, not a cure, and it's not perfect. Healthy kidneys do a much better job than dialysis does. Two major types of dialysis. Hemo means blood, so hemodialysis is when we're actually taking the blood out of the patient's body, running it through a machine to filter it, and then giving it back. It's a little more, it imposes on your life a little more because you have to go to a dialysis office or clinic a few times a week for the most part, unless you want to be trained to do it at home. And then peritoneal dialysis can be done at home, but it does have to be done more often, typically, usually daily. So you have to have a surgery to get this catheter placed into your peritoneal cavity, and that catheter will remain there. You use the catheter to put this solution into your peritoneal cavity. The solution draws the waste out of the blood through diffusion, and then after you let it sit to draw out waste for a number of hours, you'll drain the solution back out, and the waste will go along with it. Kidney transplant is the quote-unquote cure for chronic renal failure, but remember, transplanted kidneys aren't going to last as long and aren't going to be as great as real kidneys. So some people don't consider it a cure. You only need to get one kidney transplanted because one kidney is all you need to survive, which means you can donate a kidney and still be living. So kidney donors can be dead or alive. With any organ that gets transplanted to the body, there's always a chance that your body's going to reject it. So they have to make sure that the donor and recipient are matched as far as blood type and other things. And then the recipient has to take medications to suppress their immune system, because the immune system would be what attacks the new kidney. Kidney transplants aren't something you can just say I need and get one overnight. It usually takes years until you get matched with a proper kidney. So in the meantime, the patient will be on dialysis and will have to take care of their diet and things like that. To take care of themselves until they can hopefully get that transplant. So that is all, and good luck studying, and thank you.